Alberta's top public health doctor says the latest COVID-19 numbers are like watching floodwaters rise higher and higher. You heard Dr. Dina Hinshaw say that just moments ago. And those climbing case counts, they aren't just in her province. Canada's 7-day average for new cases is now at a pandemic peak, 8,444. It's a national trend line that's been getting steeper since the middle of March, curving up with the increasing spread of the virus variants in parts of Ontario, Quebec, Alberta, and British Columbia. And we begin on the issue of hospitalizations in those provinces, also climbing a new record level in British Columbia, bringing talk of new restrictions in that province and in Alberta. John Northcott leads our coverage this morning, beginning, John, with the BC picture. Good morning.
Good morning, Heather. Yes, and we're talking about, you mentioned an increase there, an increase in ICU admissions, some 20% in the province of British Columbia as they watch variants rise, as they watch case counts rise, as they deal with a almost 10% test positivity rating, almost 14% in northern parts of the province. And this is, as the medical officer of health has previously said, that anything over 5% was concerning. So they're watching that extremely carefully. This is a situation where there has discussions, we understand, at the cabinet level about the possibility of closing the border between BC and Alberta. Now, as we've seen in the Atlantic bubble, there have been closures amongst provinces, smaller provinces, but there is, as you can imagine, a tremendous amount of back and forth between Alberta and British Columbia. So that would be a drastic move, not only because they fear what might be coming from Alberta, but because of the growth of the P1 variants in British Columbia and not wanting that to continue a spread eastward. The Prime Minister talked about the possibility of such border closures. Let's listen to him.
Every step of the way, I've been supporting premiers and territorial leaders on what they need to do to keep people safe. That's the role of the federal government. As we saw with the Atlantic bubble, as we saw with the Arctic territories, they make decisions around closing off their regions. That is something that we are supportive of.
So again, whether that would apply to the BC British Columbia border, we will have to wait and see on that. Speaking of the situation in Alberta, let's look at some of the numbers there. And again, they have concerns over, we look at the case count, you can see it there, that dark red portion is Alberta. As they are concerned about this, we're seeing various parts of the province take action. We have the schools in Calgary moving to close. We're talking about thousands of students there, but when you consider that 1 in 5 Alberta schools are either on some kind of alert or in some kind of an outbreak, that's why they're taking those steps. 52,000 students affected there. This is everything from a lack of staffing, including, for example, a lack of substitute teachers. This is a statement from, on the school closures, from Dr. Dina Hinshaw. She says, we're seeing a sharp rise in cases among school-aged Albertans as well as those of other age groups. While this is an operational decision, I support it and ask that parents and students continue making safe choices to reduce the spread of COVID-19. So we're talking about some 2,600 young people, meaning between the ages of 10 and 19 in the province of Alberta. This out of a case count of some 15,000. Still, though, this has resulted in some opposition pushback. Let's listen to this MLA.
Jason Kenney clearly doesn't have any idea what's happening inside Alberta classrooms or communities. Make no mistake, Jason Kenney's weak and ineffective leadership led to this third closure of Alberta schools. Jason Kenney failed to give Alberta schools the resources they needed to keep classrooms safe.
And that is the situation in at least 2 of those provinces, Heather, as again, we're seeing right across the country, as you mentioned off the top, Saskatchewan, Ontario, Quebec as well, similar stories.
Thousands and thousands of cases, John, but as amazing as it may seem to people, there was a part of Canada that had not seen a single case of COVID-19, not throughout the duration of the pandemic. All of that has now changed.
Yeah, we're talking about Iqaluit. We're talking about a case there that has shown up there in the community. Now this, where they've had some 400 cases in the territory, most of them though in that community of Arviat. We can tell you that they have not had a case since March, but still we're seeing the situation there with that one case, and they are resulting in effectively complete clampdown in terms of all non-essential services have been cancelled starting as of their time, 7 a.m. this morning. So we're going to watch that as that plays out over the next coming days. But a situation that not only because of the isolation factor, but also because of a high immunization rate that they've managed to target those areas, that case showing up is concerning to officials. Heather?
John, thank you very much. Okay. John Northcott, as we begin this morning. Now, John mentioned Saskatchewan.